Depending upon the cause of thyroiditis, whether the infectious agent, bacteria, virus is causing the thyroiditis, or there is some autoimmune disease, your immune system is the culprit, there are production of antibodies, or there are some other environmental and genetic factor causing the disease. Thyroiditis is divided into different types. Now, here I'm going to summarize the most important types of the thyroiditis that include Hashimoto's thyroiditis. Now, Hashimoto thyroiditis is a type of autoimmune thyroiditis where there is an autoimmune reaction that takes place in the body of the patient, and that results in the production of autoantibodies, and these autoantibodies then attack the receptors or the cells of the thyroid gland and lead to the overproduction or underproduction of the cells. But in Hashimoto's thyroiditis, there can be hyperthyroidism as well, and there can be hypothyroidism as well. But the more prominent one is the hypothyroidism that occur in the patients of the Hashimoto's thyroiditis. Then there is the radiation-induced thyroiditis. Now, that's mean if you are having some kind of the radiation treatment like radiotherapy, it can also cause damage to your thyroid gland and can lead to the thyroiditis. Like if the patient is undergoing a radioactive isotope of iodine therapy with the radioactive isotope of the iodine, like iodine 132, 128, then there are chances of the patient to develop thyroiditis. So this can be a reason behind due to which this type of the thyroiditis is designated as radiation-induced thyroiditis. Then drug-induced thyroiditis. Now, the name is telling us that the reason behind the drug-induced thyroiditis is the drugs. Now, what type of the drugs? The different therapeutic agents that you are using to treat other diseases. Like there can be the cytokines can be the reason behind this, and also lithium is a drug that can cause thyroiditis, and similarly interferons can also cause the thyroiditis. So there are some agents that can lead to thyroiditis in patient. Then there comes the subacute thyroiditis. Now, subacute thyroiditis is also a sudden start of the inflammation or sudden inflammatory condition that lead to in the appearance of the symptoms or clinical presentation in the patient, and it's of short duration. And then comes the acute infectious thyroiditis. Now, acute, as the name is indicating, that it is also of short duration, but it is very severe and it is also sudden. Now, the difference between acute and subacute thyroiditis is that the subacute thyroiditis will be less severe as compared to the acute infectious thyroiditis. Rest of the things are almost same. Both are sudden in onset and both produce symptoms in the patient. But the difference is that the acute one is much more severe. It causes more severe pain and more prominent symptoms in the patient as compared to the subacute thyroiditis. Now, apart from these types, there are some other types that are also known, like there is the silent thyroiditis, that is also known as no pain thyroiditis, that does not cause any symptom in the patient. And there is also the renal thyroiditis, that is another type of the thyroiditis. Also, this type of thyroiditis is caused by a special type of the virus, and that's why it is characterized into a different class. However, these are the major or important types of the thyroiditis. Another type of thyroiditis is postpartum thyroiditis. Now, this can be due to the antibodies that are produced due to the fetus, and during the delivery. If there is the death of the patient, then the postpartum thyroiditis can be observed during the examination. So these are some types of thyroiditis.